Thanks, Mark. Rhode Island is facing a problem 3 years after it started signing up residents under the Affordable Care Act. The state agency created to sell the coverage, HealthSourceRI, has been lagging in their enrollment efforts. The real problem with dwindling enrollments means that HealthSourceRI is not making as much in their premiums, which is one of two ways that they book revenue. What's the other way? Taxpayer funds. And if you think the federal government will help, well, there are a couple problems with that. First of all, we were given over $150 million in federal funding for this program, and that well is now dry. The second issue is HealthSourceRI itself. Rhode Island is one of 13 states, including Massachusetts, Connecticut, and Vermont, that chose to run its own state-based insurance exchange rather than joining the feds. Rhode Island did very well enrolling residents when it first started, but federally managed markets, like Maine, performed well and spent a fraction of what Rhode Island did to create its state exchange. There are probably many reasons for the slower enrollment growth, like Rhode Island's aggressive expansion of Medicaid, but here's something that Projo reported. In Rhody, the vast majority of individuals who buy health coverage on the exchange are eligible for financial subsidies. But as income levels rise, subsidies fall off, and so does participation in the exchange. And of course, if people are working, they are offered health insurance, probably for less than Obamacare costs. And the Providence Journal also reported that Rhode Island has added over 8,000 new jobs. So what's more important to our politicians? HealthSourceRI enrollees or new jobs? Doesn't look like you can have both. Mark?